I'm Dr. Tim Hlavinka. I'm a general urologist at Urology San Antonio. About 40% of my practice is neurourology and sexual medicine. So I also put myself on there as the Center for Female Sexual Medicine, but I do both male and female sexual medicine. And then the remainder of my practice is general urology. But I developed an interest in MS and neurogenic bladder early on in my practice for the lack of service for the rehab hospitals when I came into practice in 1991. In addition, our maid of honor in our wedding and our very best friend developed MS at about that same time and died 2 years ago in February at age 50, unfortunately. And so there's been both a professional as well as a deeply personal interest in MS for me and watching our very best friend go through this, as well as several friends now that I call patients or patients that I call friends. So I think that to not discuss sexual function and bladder function in the same talk would be remiss, because so many times I'm the only doctor that brings this up in MS patients. And I find that a great majority of them are aching to ask these questions of their providers, and there aren't a lot of answers. There are answers, and they're good answers, as you'll see in a moment. So let's talk about sex now. That'll keep everybody's interest up again. So about 70 to 90% of men will develop male sexual dysfunction within 10 years of getting MS. And the most common problems is difficulties with erections, which of course is the most common problems with aging too, but MS patients tend to get it much younger. Many times patients will complain of a loss of sensation, difficulty achieving orgasm, and difficulty ejaculating. And obviously those can have important impact on younger MS patients who still may want to have fertility. The Viagra-type medications, Cialis, Levitra, Viagra, I don't plug any of them. They all work fairly well, and they work very well in MS patients. Many times there's a lack of desire, and when there's a lack of desire, we have to look for male hormone levels. So sexual function, meaning the ability to get and keep an erection, can be done very well with the medications like Viagra, but the desire to have sex and the desire, and I should say the sensations and pleasurable sensations from sex and a good orgasm many times are affected by a low testosterone level. And many of my patients, this is the reverse of the usual couples problems. The MS patient will be a male and come in with low desire, and she's young and she's got lots of desire, and she says, well, can you fix him, doc? And why not? And the problem often is, and which is a real twist, let me tell you, the first time you hear it from the other side. So the problem often is a low testosterone. And I think it's also important to look for low testosterone in men with MS because of the other profound effects of a low testosterone on their muscle function, cognitive function, skeletal muscle density, and their ability to be agile. All of these things are quite important. Testosterone is quite important in men to have good levels, not just for sexual function. And many times when patients come in with the usual symptoms that patients who have low testosterone, particularly if you have MS, fatigue, weakness, inability to get around, you have to differentiate other diseases from this, like low thyroid. So many times you send them to their primary care doctor, check the thyroid levels, make sure everything's okay with that, check the testosterone, and see whether or not it's low. Now, I argue many times with a lot of the testosterone experts about what levels should be considered normal. If I have a patient that I am at all concerned has low testosterone, even if it's very borderline for age, if they're an MS patient, I'm going to treat them sooner than I would the other guys because I think they have a lot more to lose. Muscle mass, bone density, cognitive function, sexual function. So I'm going to put them on doses earlier, and I'm going to make sure they get to higher levels to achieve improvement in their symptoms. And for a lot of these guys, they really do need higher doses. So let's look at some common themes with both sexes. Many times we have to consider the impact on the partner. You'll have a woman who's young, who's no longer having sexual desire and has a very young partner. Same thing I gave you in reverse about the male who has low desire, and his partner may take this to heart. Typically, we're concerned that our partner no longer is attracted to us, and that could be the farthest thing. We certainly need this physical touch when we are going through a chronic disease, and we certainly need this most from our partner. I think it's very important to recognize that things have to change. What you considered a 4th of July fireworks display in the past is no longer the case. You have to redefine what you consider good sex. what we call a satisfying sexual encounter in the business. No wonder we can't get these studies to be done. What's a satisfying sexual encounter? There you go. That's what I said. July 4th fireworks, a sparkler. It doesn't have to be, doesn't have to be here all the time, right? So mobility issues and weakness can be a big issue for a lot of patients. And many times it's very important to say, I'm at my strongest from about 8 to 10 in the morning and I get weak after that. And so that's when we should make love, Call your boss, tell him you're going to be late, and tell him you got a very good reason, So some of the takeaway messages about both bladder and sexual issues is that it's really important to coordinate your care between your primary care docs, your neurologist, and your specialist. Make sure we communicate. This is a multifaceted problem, multifaceted disease, and it requires a multifaceted input from your doctors. It's hard these days. Some of the hardest things to do are to pick up the phone and call a doc sometimes in the middle of a busy day. But sometimes that's necessary to make sure that care is coordinated. Recognize that bladder and sexual issues can be treated. Don't let somebody tell you no. It's very rare that we say this is the best we can do and there's nothing that we can do for you. And make sure that you go see a specialist when you're not getting the answers that you want. And I believe that's it. Any questions? Thank you. Thank you.